So the community that we're serving is an ethnic minority in Cambodia. They're called the Cham people of Cambodia. They are a small population, only 2% of the general total population of Cambodia. And this population has suffered for a long time, especially during the time when Cambodia was ruled by the Khmer Rouge regime, where they basically did ethnic cleansing and exterminated and massacred almost half of their total population of the Chams. So in the beginning, there were around 1 million Chams living in Cambodia. So only after 5 years of the Khmer Rouge rule, they managed to massacre almost half of them. So that was in 1975 to 1979, and as you can imagine, it's only 40 years ago, so it's still within a generation. So today we can still see that they are very lagging behind in terms of education, economic, and health outcomes. And being an ethnic minority in an already poor population adds to that barrier, in which they speak their own language, they have their own culture, and practice different religion. So it puts a lot of pressure on the Cham people, which in the end makes them more vulnerable to diseases. So that's why we wanted to help this small population by coming in, although we are foreigners from Malaysia, but we want to empower the community by hiring doctors from their own community. You see in Cambodia, there's a lot of foreign NGOs coming in to build hospitals and clinics. But one thing I see is that most of these physicians from overseas lack cultural competence when treating patients from an ethnic minority. So in the end, this ethnic minority, the Cham people, would rather go to traditional healers rather than going to seek treatment in terms of modern medicine. So this is a huge barrier. So we want to break that barrier by bringing in their own people, working there at the clinic, speaking the same language, and trying to remove as much barrier as possible to make these people from the community feel safe to come in and get treatment. So one story that is interesting is that I have an elderly lady who came into the clinic. So she just became a victim of snatch theft a couple of days before coming to our clinic. She was riding a motorcycle and her handbag was snatched, so she fell down and broke her arm. So because they were very used to visiting traditional healers, so she went first to see a traditional healer for the numbness that she felt in her arm. So what the traditional healer did was actually massage the arm, and for the numbness, he said that the treatment should be try to move your arms a bit more, which is exactly the opposite of what you should do when faced with a broken arm. So this treatment that we did was very simple. It was giving pain medications and also putting a cast on the arm. So it's a very basic treatment that you can get in modern medicine. But because before this she didn't have that access, if we weren't there, her arms would have gotten worse and she could be disabled most of her life. So we really feel like some kind of satisfaction in being able to be there and treat such a simple cases, although it's a simple case, but it means a lot to us and to the patient.